One of the patients I would like to talk about today is a young boy, 12 years old. He was diagnosed very early with Ehlers-Danlos syndrome. He was seen once a week for about 4 months or so, and he also had a home exercise program. Seth is going to do some knee extensions, so he's going to be kicking out with flippers, trying to strengthen his knees, the muscles on the top, the quads, and his hamstrings. So he's going to go full motion, bend the knees all the way, and then kick out. Okay, and we usually do this about 2 minutes or so. And then he's going to keep his knees straight, and he's going to flutter kick. We would probably do that about a minute 3 times. Give him a little rest between those. Next we do shoulder flexion and extension, alternating, working on proximal shoulder strength and also core strength. We usually do about 30 reps or so. Okay, and then we'll switch to horizontal abduction and adduction.
Yep, just like that. Keep those arms nice and straight.
And we're increasing the resistance a bit with Seth by using the Aquajogger mitts. When he first started this, he was not using those mitts. Now we're doing windmills, again working on shoulder strength and core strength. We do this for 2 minutes. And Seth occasionally needs cues to keep those shoulders straight out to the side. Very nice. And we also do punches, again keeping the resistance a little bit with the Aquajoggers. We do this for about 2 minutes. And we're going to do some tricep presses with assist from the therapist. So it's partial body weight. And we do 3 sets of 10 with about 30-second rest between each set. And he needs a little guidance to keep his trunk and pelvis straight up and down, but he does a really good job. Now we're doing push-pull with the kickboard. Again, upper extremity strengthening and core strengthening. And we continue with this one for about 2 minutes. Now we're doing some reverse abdominal curls. We do about 3 sets of 10. Okay, now we're doing some prone hip abduction and adduction. We like to do this one about a minute 3 times, and to make it a little bit more challenging, we have Seth speed it up a little bit. In and out, really fast, Seth. There you go. And then we do a flutter kick. Again, working on hip flexion extension. With him in this position, he also gets some good work on lumbar extension. And we do this a minute 3 times, and again increasing the difficulty by kicking faster and keeping those knees straight. And when he's ready, we can also increase the difficulty by adding some flippers on his feet to increase the workload. Now we're doing some high knee walking with the flippers on. We have the treadmill at about 0.7 miles per hour. And this is a very good one for working on some proximal strengthening and control. And we're doing some walking on the treadmill. And with the HydroWorx pool, it's very nice that we're able to adjust water height as needed. Seth is kind of short compared to adults, so we're able to lower the water level just a little bit so that he's not drinking water as he walks. We're also able to have Seth do some jogging, which again has much less pain in the water as compared to on land.